Okay, we're going to get started here. We're just going to get Dr. Hirschfeld set up here, and we'll go ahead and begin. For everybody who's joining us, I have put the phone number, which is our access number for the Intermountain Healthcare Long COVID Navigator program that we're going to be talking about today. So that is the number that people should contact for assistance with long COVID, and we'll get into some of those details in just a moment.
Mm-hmm. Hi.
Good morning, Dr. Hirschberg.
Good morning.
Good morning, Dr. Harris.
Good morning.
Okay.
Give me a second.
Okay, Ryan, we're going to go ahead and start broadcasting live on our Facebook page, and we'll go ahead and begin today's press briefing. So give us one moment.
Okay, I'm going to tell them through the chat.
Sounds good.
Okay, 1 second. Actually, if you can hear me, Jess. Can you hear me, Jess?
I can.
Okay, I'll just cue you. I'll tell you in a second. You got 5 seconds.
Okay.
Wait 1 second, sorry. All right. And go ahead, Jess.
Good morning, everybody. Thank you for joining us today for today's Intermountain Healthcare COVID update and briefing. Thank you to everyone who's joining us on our Facebook page. And again, thank you to the reporters who are joining us on our Zoom call. A big welcome to our physicians today. We're going to talk a little bit about a new resource for those who are experiencing long COVID symptoms, who are identified as long haulers. In studio this morning, we have Dr. Ellie Hirschberg, who's a critical care physician at Intermountain Healthcare, and Dr. Hirschberg works very closely with these patients, both on the inpatient side as well as they transition to the outpatient side. Joining her from Utah Valley Hospital is Dr. Dixie Harris. Dr. Harris is also a critical care and pulmonary physician with Intermountain Healthcare who treats COVID patients both inpatient as well as a number of patients on an outpatient basis, and they're very familiar with this program and the issue of long COVID. So thank you both for joining us. I'm going to start with you, Dr. Harris, and let's just talk about, before we get into the details of this new program and resource for patients, but why don't we start with you and tell us what it is we're seeing with long COVID. What's the experience that you and Dr. Hirschberg, and then Dr. Hirschberg will give you a moment, but let's talk a little bit about what we're experiencing here in Utah in terms of through the Intermountain Healthcare system with people who are experiencing ongoing symptoms.
Yeah, so we started seeing these patients in the late spring of 2020, and the patients have been coming to us for the past almost 2 years now. And we're in the process of just learning this whole new entity. And basically what we're seeing is patients who have ongoing symptoms, and we're using the definition of 3 months. Some people say 2 months, the symptoms after they've had a COVID infection. And many of these patients aren't even hospitalized, or do not even have bad infections, but yet they have ongoing symptoms. And the symptoms so far described in the literature, somewhat upwards of 2,000 symptoms, but the most common is profound fatigue, brain fog, shortness of breath, coughing, heart racing, and there's many, many other symptoms. And it's a very common thing. It ranges between 5 and 30%, depending on which study you're reading. And it's really been a process that we've been just learning about and trying to understand. We're learning a lot from our patients, and both Dr. Hirschberg and I have seen many, many patients with this entity as well as our colleagues.
Dr. Hirschberg, what are you seeing? What are some characteristics of this, what we classify as long COVID, and what are patients telling you that you hear after they finish their infection?
Well, I think the most overwhelming sentiment from our patients, on top of everything that Dr. Harris has said, is frustration. Really, their symptoms are progressing or sustained despite all their best efforts at trying to heal. I think the good news is that with a sort of carefully planned out, joint decided plan, we've actually been able to see people improve over time. So my message to the community is it will get better. It just takes a long time. We've seen a lot of people. I would add chest pain to the litany of symptoms that Dr. Harris described as being one of the things that's most common, as well as some neurological zingers is what people call them, along with their brain fog. And many of the patients I've seen back at this point have really started to recover and started to improve.
Dr. Hirschberg, is there anything that stands out amongst those who experience these ongoing symptoms as opposed to those who have the infection, recover from that, and are able to seemingly move on? Is there anything that stands out among this population that seems to be experiencing ongoing problems?
I don't know what Dr. Harris has seen. What I have personally seen is a lot of healthy people who don't have pre-existing conditions, a lot of athletes, a lot of fully working individuals who the fatigue and the brain fog is so profound that they're not able to get back to their pre-COVID degrees of exercise and activity. And that has been a little bit more different for me than I also see patients who are either hospitalized or in the ICU with COVID, and many of them are recovering a little bit more quickly back to their pre-healthy or pre-COVID state.
How about you, Dr. Harris? What are you seeing for those who seemingly the population that has ongoing issues? Is there anything that stands out to you amongst these patients?
Yeah, I mean, what I'm seeing kind of matches the demographics that is reported in the literature. Many of them are younger and more females than males, but I certainly have seen a fair share of male patients with this. And just like Dr. Hirschberg said, these are people who didn't have risk factors, not diabetics, not hypertensive, doesn't have coronary disease, never got very sick with COVID, but yet, they had fevers, chills, headaches, the whole works when they were sick with COVID, but it just lingers. All these symptoms continue and continue.
What's the normal recovery process? What should people expect when they do have a COVID infection? Normally, what would we see in somebody who's not having long COVID? What kind of period of recovery is considered kind of normal? Dr. Harris.
Okay, so, usually patients are better in a few days. Now with the Omicron is what we're seeing. However, I'll see patients still recovering for 2 to 3 weeks. And in anybody that gets the COVID infection, whichever variant it is, they have to be really careful about going back to full exercise and really listen to their bodies. And typically, Dr. Hirschberg and I are not necessarily seeing patients 2 to 3 weeks after the illness. We're usually seeing many, like usually 6, 8, 12 weeks. And that's when they're starting to come in. We do have some patients with some unusual complications that can affect the lungs that both of us are seeing, which is they get this organizing pneumonia type thing that it inflames the lungs, and that usually shows up 3 to 6 weeks after the infection. Typically the blood clots we're seeing usually come in within a month or so after infection. So those are kind of things we see. The things I tell patients is to really listen to their body. This is not a typical cold. You have to listen to your body, listen to how your body feels with activity. Even just patients walking across the room, they can become short of breath and their heart can start racing.
Yeah. Dr. Hirschberg, let's talk about this resource that Intermountain has set up, this long COVID Navigator program. Let's talk about why it's needed and what that process is and why we are setting this up. I know that resources are needed for these patients. Talk a little bit about that, please.
Well, we've really tried to come up with a multidisciplinary approach to helping these patients, both with acute long COVID and post-acute COVID. Because as everybody has seen and Dr. Harris alluded to, the COVID molecule seems to affect a lot of different organ systems in somewhat unusual ways than what traditional medicine is used to sort of diagnosing. So the Navigator program really was started to try to bring in all of these multi-specialties and get the patients to the right place in a quick time frame. A lot of our subspecialty clinics are booked out typically, and this is a way to get people in either to see me, Dr. Harris, or the other subspecialists rather quickly. So Tina, who is the primary navigator, she's available on a phone call pretty much all during the weekdays, during working business hours, and can go through the symptoms with the patients to help figure out exactly where the best place to start in terms of their recovery.
Dr. Hirschberg, I saw a study out of the University of Michigan that identified perhaps as many as 45% of those who've been infected with COVID potentially have long COVID symptoms. If you extrapolate that on a global basis, we're looking at more than 1 million individuals who may have long COVID. What's the experience here in Utah? Are we also seeing larger numbers given our exposure here in Utah? What's the sense that you have from that?
So I'll take that one. Dr. Harris and I are also part of a consortium with some of the other providers in the Valley, and I think we all agree that there are higher numbers than we anticipated. We opened our post-acute COVID clinic, even though we've been seeing patients for more than a year and a half to 2 years. We opened it officially about 6 months ago, and we've been pretty booked. I know Tina's been filtering phone calls left and right. So it fits with the national numbers. We've been seeing quite a number, probably 40–50% of overall acute infections have some kind of sequelae.
Dr. Harris, when these patients come in 6 to 8 to 7 to 9 weeks after their infection, what's that conversation like, and what are you able to do for these patients from a clinical standpoint?
So, the first thing I talk to the patient is, really listen to them and listen to their symptoms. But also, I think the most important thing I do at the visit is validate that they don't feel back to normal. Many times their x-rays are normal. Many times, in many of these patients, not even needing oxygen anymore. But they don't feel normal. They have the brain fog. They just don't have the energy. And it's very frustrating, but I tell them, this is what we see. We have in our clinic, we've developed a whole multitude of various symptom questions. The one thing I will say that I see there's a lot of anxiety and depression in this group of patients. And it's, these patients are suffering, and just to let them know that we are hearing them, we are learning. There's not just one specific medicine I can give that will get rid of their symptoms. So this is, we're all in this together, we're all learning. And just like Dr. Hirschberg said, we've kind of developed a whole consortium of connecting with our colleagues across the state and even across the nation, trying to understand this disease.
Dr. Hirschberg, a question from Erin Alberti at the Salt Lake Tribune. She's asked, when you say 40 to 50% of acute infections had some kind of sequelae, could you please describe what you mean by acute? How does someone know if they had acute COVID? How do we classify somebody with an acute case of COVID?
Well, my definition of an acute case of COVID is actually you have some sort of symptom. And we know with Omicron and the other 2 variants, those symptoms have varied rather dramatically. But you have a symptom and you go get tested and you have COVID. Or the symptoms that you are describing can be chalked up to COVID. I think what we've seen after that has been that essentially of those patients who have those symptoms, they usually resolve in a maximum of 2 weeks. So if you start with a runny nose, or you start with a sore throat or a headache or feeling fatigued, generally speaking, it's a little bit on the far side, but all 3 variants, you should be feeling better from your acute COVID by 2 weeks. And many people, about 50%, will still have some degree of either fatigue, sleep disruption, Maybe the symptoms of the runny nose and the sore throat are gone, the muscle aches, the joint pains are gone, but they're coming back at these sort of small episodes. They'll go for a run like they used to, or a walk, and they'll be way more fatigued or experience way more muscle fatigue than they had previously. Those are sort of the persisting symptoms. And when it lasts up to 12 weeks, as Dr. Harris was saying, then we start putting them in the category of really having long COVID.
Dr. Harris, a question from Lisa Riley-Roche of the Deseret News. She asks, what is the message about COVID infections going forward, given the possibility of long COVID? And you talked primarily that you're seeing a lot of young, healthier patients who are experiencing infection and then having ongoing symptoms that would classify as long COVID. So it's a population that normally thinks themselves as healthier and less at risk. She asks, what should the public know about this? And does the public really understand this long COVID component of the COVID pandemic?
Yeah, as far as does the public understand, I think once they know somebody that's been suffering from this, I think it's becoming more aware. But in general, like if you say as an outpatient, a young person, we're not going to see many of them in the ICU or in the hospital, but say you have 10 of them and only one of them maybe have ongoing symptoms. But this is a good reason not to catch this virus and not to go out intentionally catch it because you just want to build immunity. The one message I do have is the risk of long COVID is, depending on which study you read, it drops markedly if you've been vaccinated. So that's great because we know that not only preventing the infection, but if you have COVID, have a breakthrough infection, the chance of having long COVID or chronic COVID is markedly lower. So that's exciting. And another reason to say this is a good reason to get a vaccine, because frankly, and Dr. Hirschberg can attest to this, I really don't want to have a headache for the next 12 months. We have a variety of patients who are suffering. It's also interesting to put it in context of right now. I'm hearing about some Olympic athletes have had some long COVID, and there's some stories about those too. So it does really affect young people are used to be able to do exercise, do their activities, and it does impact them.
Yeah. A question for you, Dr. Hirschberg, from Jamie Lampros at the Standard Examiner. Is what you're seeing with long COVID, is this typical with other viral infections? And then how does maybe long COVID compare to chronic fatigue? You've described some of the symptoms that many people say that they experience with chronic fatigue. What's your thoughts on that?
Yeah, that's a great question. I think that the answers are all very similar to what Dr. Harris and I have been seeing. So the studies report that, there are some viruses previously that can trigger chronic fatigue or long fatigue. This is a pathway where antibodies trigger a response in the neural pathways. We certainly see much more of this with COVID than we have with any virus previously. But I also take care of children, and the sequelae of viral syndromes in children has always been described and fairly well known. This kind of sequelae, the large percentage of people that are getting impacted by the COVID infection, could be in part because there's so many people who are getting infected, but it also seems like there's something a little bit different about the COVID molecule in that it affects several different organ systems directly. And then the sequelae, including chronic fatigue, can be associated with sort of an elevation of the body's responses to the virus. And I just wanted to also reiterate, along with the data that Dr. Harris had quoted, I have yet to see somebody with long COVID who was vaccinated. I've seen patients who had long COVID and then got vaccinated and are still trying to get rid of some of their symptoms, but I have yet to see somebody with long COVID who was vaccinated first.
So yet another reason to be vaccinated. Dr. Hirschberg, what is the high end of the duration of long COVID symptoms that you've seen so far in terms of your experience? Meaning, and how long from symptoms with patients, long-term symptoms have you seen? Has it been more than a year in some patients that you've treated?
Yes, actually. I would say there are a couple of patients I saw very early on who were frustrated and sort of not understanding what was going on with them. And their symptoms lasted just about a year. We've tried a bunch of different treatment modalities and behavioral changes to kind of help them along their pathway. But the good news is most of them, those early patients, they've given me feedback that they're really feeling much better these days. And I think a key component of that is actually sleep. So in addition to the anxiety that Dr. Harris mentioned, a lot of these folks are having disrupted sleep. And whether or not that's from exact changes in the neurohormonal pathways that COVID stimulates in the brain, or from the overwhelm or the information, really working on figuring out new sleep patterns and getting enough sleep and enough rest has helped a lot of these patients.
Dr. Harris, what's the process? So we have a number, a phone number that people with long COVID should call into. Just to be clear, at what point should somebody who has been exposed and is still having symptoms, at what point do we want them to follow up and to be able to use this resource that we've set up? And then walk through the process, because from what I understand you, it's a multidisciplinary, also multi-provider standpoint that many different physicians and other providers will be participating in. Can you talk a little bit about the logistics of that?
Yeah, so at this point, this is really designed for the patients who are suffering a good 12 weeks on. We do, most patients get better after a couple of weeks, but some patients it takes longer. And those patients, definitely, if it's been going on 8 weeks or so, go ahead and touch base with your primary care, see if there's anything else that needs to be addressed. But once it gets over about 10 to 12 weeks is when it's reasonable to call and first off, you talk to, Dana's actually a pulmonary nurse and has worked in our pulmonary clinics and is absolutely amazing. And again, we're all learning together. We're learning from our patients as they call us. We work with them. We're collecting very carefully collecting the symptoms and the problems they're having. And based on the problems they're having is which specialist or which team is the patient's going to go to. So just to kind of give you an idea of who's been on the team, certainly the pulmonologist, but also the cardiologist, the rheumatologist, the neurologist, the Live Well team, the physical therapy team, the rehab team. So it's a huge multidisciplinary approach. And again, it's a way for Tina, through our questionnaires and our intake system, deciding which way the patient needs to go and also streamlining getting into the clinics. And as people know, it takes a while to get into a specialist. And, the other thing is what we've had through this is people who've shown demonstrative interest in taking care of these patients. Like Dr. Hirschberg and I are, we really have learned a lot from these patients and we welcome getting to see these patients ongoing. So that's kind of the first step is make the phone call. And there are patients that are continuing to do better and don't need to go see any specialist. So that's, one thing is that there's a lot of self-care that goes on and, getting patients to where they need to be in a timely manner. And certainly prioritize, if they need to go see the cardiologist, let's get them in. So this is a very unique system. Most places, in fact, I don't know of a single other navigator system in the whole country. We did this because we do serve a wide geographic region, and to just have one freestanding clinic didn't make a lot of sense. Whereas this is a way we can also use telemedicine to help connect the patients to where they need to be. There's other freestanding clinics across the country, and basically every state has them. But as far as I know, this navigator system is unique. We also, in this navigator system, we're collecting data for ongoing research. We're also part of an NIH study going on with long COVID. And so, again, this is a learning process, and we're working to best serve our patients and get them to where they need to be.
Yeah, thank you. Dr. Hirschberg, a question from Aaron of the Tribune. Since the COVID pandemic has started, how has treatment methods changed? And the second part of that question is, are we seeing anything unique to Omicron? I know it's much newer and we don't have as long of experience with that, but is Omicron having a longer term effect, although it's fairly still recent? So I don't know if you can address that, but how have our treatment methods changed since the pandemic started?
Yeah, I think I'll start with the second half of it. I don't think we've had enough exposure of Omicron to really say whether or not it's going to alter our treatment pathways for long COVID as yet. The experience with Omicron, that is. Certainly, our treatments have adjusted over time with the treatment of acute COVID. We've been actively a part of several therapeutic trials across the country and across the world, really. So there's now standard inpatient treatments for people who have COVID, and then also along with the state guidelines for patients who qualify for certain antibody therapies in the acute phase of their illness. We've also been part of the team that developed that. As far as long COVID treatments go, many of the previously published protocols have been debunked in the literature. We've gone through some different trials. Nothing has been solidly proven as of yet to reduce or resolve long COVID. There's some really interesting new studies out there. One, hyperbaric therapy, that suggests that has some promise in the sequelae of long COVID. And we are, as Dr. Harris mentioned, a part of a couple of nationwide studies, the recovery trial being one, and then a more local study that are dealing specifically with long COVID symptoms and recovery and treatments.
Okay. Well, listen, I know you guys are both very busy. We need to let you go because you're both in clinic. Thank you so much for joining us. We would remind everybody, again, the Intermountain Healthcare Long COVID Navigator Program is the name, and it's 801-408-5888. That's 801-408-5888. And again, the criteria that Dr. Hirschberg and Dr. Harris are asking is that continued symptoms at least up to and after 12 weeks. And there will be a resource where you can talk to a nurse navigator and she can triage those symptoms. And then the idea is to triage you to the appropriate resource, whether it's cardiology, pulmonology, rheumatology, or whatever the resource is needed. So Dr. Harris and Dr. Hirschberg, real quickly, we just offer you an opportunity to end our briefing today with any thoughts you have. Dr. Hirschberg, begin with you. Is there anything else you want to add before we finish the call?
No, thank you. I think you've covered everything. Get vaccinated.
Okay. Dr. Harris, anything you'd like to leave us with?
So one thing I would say to anybody that has COVID is, do a lot of self-care, wellness, and I really like the highlight on sleep. That's also one of my specialties. Just optimize and really take care of yourself. Most of these patients need more sleep than they generally need during the recovery phase, and just patience. What we've seen, and this is a bright spot, is we see our patients getting better over time. So that's something good to know.
Okay.
I will interrupt. Self-compassion is something I think I really encourage with our patients. They have to be compassionate with themselves and recognize that it takes time.
Well, thank you so much. Thank you both for all that you're doing. Thank you for taking time out of your busy schedules today. Thanks everybody for joining us both on the Facebook broadcast as well as our Zoom call. We will send out a link to this recording of the briefing from today to the reporters who are joining with us. And again, we thank you for your time and appreciate all of you for all that you're doing. Thank you and have a great day. Bye-bye.
Thank you.
Thank you.
Bye-bye.